Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. Here are some of the highlights this hour. World Health Organization says the new threat is lack of solidarity and leadership, not coronavirus. Calls for unity among nations. Presidential task force gives hope that the declaration of Nigeria as polio-free is a signal that someday the nation will overcome COVID-19. And African countries create one-stop shop to lower costs of COVID-19 tests and protective equipment. The World Health Organization has warned of a lack of global leadership over the pandemic. WHO Chief Tedros Ghebreyesus has told a virtual health forum that the world is in desperate need of national unity and global solidarity. The politicization of the pandemic has exacerbated it, he said. The greatest threat we face now is not the virus itself, but the lack of global solidarity and global leadership. The WHO has also said the pandemic is still accelerating and that its economic and other effects would be felt for decades.
The greatest threat we face now is not the virus itself. It's the lack of global solidarity and global leadership. We cannot defeat this pandemic with a divided world. The world is in desperate need of national unity and global solidarity. The politicization of the pandemic has exacerbated it. Ultimately, the pandemic has shown that we are humanity, one humanity, and none of us are safe until all of us are safe.
Now, following the international scramble for COVID-19 test kits, protective equipment and any vaccine that may emerge, African countries are pulling together resources to set up a one-stop shop to give the continent a fairer chance in the pandemic fight. The African Medical Supplies platform is expected to work like an online store, unlocking access to supplies across the continent, which could save the continent a lot of money. Now, during the digital launch, South Africa's President Cyril Ramaphosa said it was the silver lining to COVID-19 and the glue that is going to bind the continent together. He spoke in his capacity as African Union chair. The platform is set to be run as a non-profit by the Africa Centers for Disease Control and Prevention in Ethiopia, with a bank in Egypt already managing a $3.8 billion COVID-19 fund for the continent. The coronavirus epidemic is an ongoing public health emergency of international concern. And in Nigeria at the moment, there are 20,244 known infections in the country. Currently, 518 people have died. 12,847 of them, the people are still sick, while 6,879 people have recovered. The latest figures follows the addition 436 new cases recorded in 18 states and the Federal Capital Territory. This is according to the Nigeria Center for Disease Control, NCDC. Lagos State in the southwest remains the epicenter of the pandemic in the country with 8,576 cases. It has discharged 1,444 persons. The SCT is the second highest in the North Central region with 1,567 cases. Kano in the Northwest has discharged the second highest number, 712 recoveries of its total cases at 1,190. Once again, River State displaces Edo in the South-South with the highest number of 874 cases in that zone, while Borno still tops in the Northeast with 468 cases and Ebonyi in the Southeast with 234 cases. The Presidential Task Force on COVID-19 in its briefing today called on Nigerians to give information to the NCDC on persons requiring their attention in the area of testing and treatment of the coronavirus. The Secretary to the Government of the Federation and Chairman of the Task Force applauded the declaration of Nigeria as polio-free. He says the move is a signal that the nation will overcome the pandemic.
The Presidential Task Force is pleased to express its appreciation to the National Association of Resident Doctors, NAD, for demonstrating the spirit of patriotism and understanding by calling off the industrial action its members embarked upon, abiding by the Hippocratic oath further gives us comfort that we would win this fight. On the part of government, we would continue to ensure the welfare and safety of all workers will never be neglected. The Presidential Task Force has identified lack of information about case definition protocols, location of testing centers, inability to reach call centers as obstacles to getting needed help. The Presidential Task Force has therefore directed that more awareness be created on the location of testing centers and how to get tested, especially when you fit the case definition. Similarly, I implore us not to be afraid of undertaking the COVID-19 tests. Testing positive for COVID-19 is not a death sentence, but failure to test, especially when symptoms are evident, could result to death, as it may be too late once the symptoms become full-blown. The declaration of Nigeria as polio-free nation last week is a welcome development, and we congratulate all those that participated in the long-drawn battle to rid Nigeria of the disease. This declaration is a signal that overcoming COVID-19 and indeed any other infectious disease is possible and shall be achieved.
For the Minister of Health, Dr. Othage Hanire, the call-off of the strike of the resident doctors is heartwarming, as the WHO has already made large donations of protective and medical equipment in a battle against COVID-19.
The National Association of Resident Doctors, who embarked on strike a week ago, have happily suspended their industrial action following continuous dialogue, constructive engagement, and response to grievances that were tabled, like payment of hazard and inducement allowances and provision of personal protective equipment. In connection with that, we are happy to say that Nigeria received a large consignment of medical supplies on Saturday, the first of a series of deliveries from the United Nations Group in Nigeria and the European Union, which several ministers were on hand to receive at the airport on behalf of the federal government. The donation is very reassuring to us because we can now make up our stockpile, and it is made up of a large number of various categories of personal protective equipment and 547 oxygen concentrators, courtesy of the World Health Organization, which our experience in Nigeria shows are more in use than ventilators. The Federal Ministry of Health particularly appreciates this addition to our case management assets, and we thank all the donors through the resident coordinator of the UN family in Nigeria, Mr. Edward Kalon.
Now, it's a fight against a global pandemic that threatens lives and livelihoods. Dr. Olawale Oladubu is a clinician and clinical laboratory scientist. He joins us on the program to tackle some of the issues arising from the pandemic. Welcome to the program.
Thank you.
All right. Should we be worried? Because we're now being told today that we're more likely to contract coronavirus when we go out than before.
Yes, I think the situation right now calls for a lot of concern, and we really need to be worried about it. As it has been said that the virus does not have legs, but it needs human beings to transmit from one place to the other. So the more we interact with one another, the more we mingle with people, yes, the risk is very, very high. So, and I think, in addition with the weather situation now, yes, there's every cause for us to be worried.
Perhaps you might share with us some of those risks, because we know there are certain diseases that are prone to springing up during the rainy season, you know, and what more precautions people should take. There's also, on the other hand, the chances that some healthcare professionals might diagnosed with regards to COVID-19 and perhaps some of these other ailments or diseases that might, you know, creep up at this time. But I'd like to ask about the prevention protocols, if anything has changed, because we're seeing the World Health Organization, for example, putting out a tweet that you should wash your hands for between 40 seconds to 60 seconds and using hand sanitizers between 20 to 30 seconds. And I used to think that it was 20 seconds washing of your hands, for example. So is there any difference in that prevention protocol?
Okay. Yes, there are some diseases that are sensitive to temperature, or going by their causative agents. And based on that, there are some that will thrive more at this time, like common Haemophilus influenza and the rest of the common flu that we have been used to. And many of these conditions have similar symptoms. So, and this is where the clinical experience and diagnostic acumen of healthcare practitioners come to play. And talking about the preventive protocols, well, if washing hands for 20 seconds used to be effective, then washing for longer won't be harmful, if you look at it that way. And if you also look at it, the technique involved in the hand washing, for it to be very effective, then I think longer period of time is also necessary. So it's not just washing the hands. You know, people wash their hands haphazardly, but there's a particular technique to doing this. And if you have to do that thoroughly, then I think you need to do it for a longer period.
Do you think there's still people who doubt that COVID-19 is coronavirus, or that the coronavirus is malaria and then vice versa?
Yes, in fact, some people still think that there's nothing like coronavirus, that everything is just a scam and all that. I meet with people every day. And for some years, they are aware, but they are just being mischievous. And just yesterday, I met with a group of people, and they were saying that, no, there's nothing like coronavirus. I'm a frontline worker, and I asked them that if they could go with me to the field, you know, today, none of them, you know, was willing to go. So which means that the fear is there, the awareness is there, but some group of people are just being mischievous about, you know, sending out false information about the reality of this disease. So basically, malaria, coronavirus, yes, they have symptoms that could cross-match, you know, but then they are strictly different diseases which need also a strict clinical diagnosis and then management. Yeah.
All right. We'd like to thank you, Dr. Olawale Oladubo, a clinician and clinical laboratory scientist. Thank you for joining us on the program.
Thank you very much for having me.
The Akwa Ibom State government has been commended for its investment in healthcare by building institutional capacity to address the coronavirus pandemic as well as healthcare needs of the citizenry. The Director General of the NCDC spoke glowingly when he visited the state alongside Dr. Fiona Braka, country officer of the World Health Organization, on a walking tour of medical facilities and assessment of the state's government response to the COVID-19 pandemic.
Really impressed by the hospital facilities and things I've seen, and I think we're ready to manage patients almost. There'll be some modifications in terms of setup, but I think the most exciting thing for me personally is just seeing this laboratory and seeing how well it has been kitted, the expertise of the colleagues that are working here already, their deep knowledge of the processes. And I'm not surprised because my team was here a few days ago, a week ago, and they called me and said, DG, this place is good to go, without much investment in terms of time and energy. So I'm really happy to be bringing Akwa Ibom into the national network of molecular laboratory capacity, which is really what we're trying to build.
It's been very enlightening going around to see the isolation facilities, the capacities that are there, the lab capacity, and how the state has used the opportunity of the COVID response to build institutional capacity, not just for responding to this outbreak, but thinking beyond. We are quite pleased and impressed with the human resource capacities in the state for case management as well as the lab, and the opportunities to share experiences from the state with others.
We have more on the COVID-19 updates when we return. Still talking about the COVID-19 pandemic. Dr. Gabby Macaulay is a general practitioner in the United Kingdom, and she joins us now. Welcome to the program, Dr. Macaulay.
Hi, thanks for having me again.
All right, thanks. From your view of things in the United Kingdom and perhaps the way the world is fighting the pandemic, would you say that the viral curve is flattening in the UK?
Yeah, so it's actually really good news how things have happened and how things are going in the UK in terms of the R rate, which is what we look at to see if the virus is spreading or not. It's been below 1 for quite a long time now in the UK, and the numbers really are coming down. So it means that all the measures that we've taken in terms of social distancing and also trying to trace people, trace contacts of people who've tested positive, it shows that it's all working. So it's good news over here.
So UK appears to be doing a lot of things right, but we're hearing from the World Health Organization that there is another fear of a pandemic, and this time the lack of solidarity, the lack of leadership to handling COVID-19. What are your thoughts on this?
Well, I think that the WHO are right. It's really important that all countries work together, because if there is a second wave in one country, this is going to affect the whole world. It only takes one person to start a pandemic. And because flights are beginning to get up and running again, there is kind of that fear that virus will be introduced to a country. So, for example, I think it was Australia or New Zealand, one of those two countries managed to suppress the virus and have no cases. And then there were 2 people who flew to that country who had the virus, which kind of made that country fear that there'd be another wave. And also, it's important to be very vigilant, because Germany, which has had such a fantastic response to the virus from day one, they have actually seen a spike in their R number, and there has been a cluster of cases in part of Germany. So it's really important that everyone remains vigilant. The same thing happened in Beijing. Until there is a vaccine and widespread take-up of this vaccine, we need to kind of learn how to live with this virus and respond appropriately.
How do you think the African continent is doing? We're seeing other regions, continents, still saying that Africa is doing a lot better in terms of the number of cases and the number of those that have died. However, the continent is still seeing a spike in cases every week.
So what I would say is that when you look at cases, this is number of deaths and also number of positive cases. This depends on how good the data is coming in. So how good is the reporting? How many people are being tested? How many deaths are being accurately recorded as COVID-19 deaths? We know that the kind of report rates coming out of the UK were not very good in the beginning, and they improved. We can rely on results from America, results from China, some people have said is questionable, and also South America. When it comes to Nigeria, I had a look at the number of cases today, and there are around 42,000, sorry, not 42,000, there's about 20,000 cases in Nigeria and about 518 deaths. Again, I'm not on the ground. It would be interesting to speak to people in the different communities to see what is the overall excess death rate above and beyond what the death rate was this time last year. And sometimes that can give a more accurate reflection of what's going on.
Now that you've mentioned Nigeria, healthcare workers' welfare was one of the high points of the past week. Resident doctors, pharmacists, all calling on governments to address their needs. Some of them have, gone back to working, but are still asking the government to do a lot more to protect them. How would you rank the healthcare workers in Nigeria compared to the kind of system you have over there?
So, I mean, in all countries, healthcare workers are needed. So you've got doctors, you've got nurses, you have the multidisciplinary team, which involves pharmacists, healthcare assistants, etc. And it is important that these professionals are protected when they're on the front line serving their communities, because it's quite difficult to maintain social distancing when you're in these roles, and you might be actively exposing yourself to people who are infected because you're trying to help them. So it's so imperative that personal protective equipment is given to these people, and this includes, masks, gloves, aprons, goggles. Depending on the nature of the contact, sometimes people may require gowns, etc. So we have the same challenges in the UK as what you will be facing in Nigeria, but we're a little bit ahead of you in terms of our curve and response.
Thank you so much, Dr. Gabby McCauley, General Practitioner in the UK. Thank you for joining us.
Thank you for having me.
And like we mentioned, the World Health Organization recorded the highest one-day increase in the total cases, 183,000, most coming from Brazil, that has recorded more than 50,000 COVID-19 deaths. And this is followed by the United States and India. The high level of confirmed cases, according to the World Health Body, is partly down to a global increase in testing. There has been growing political tension also in Brazil, as it confirmed more than 1 million coronavirus infections. Meanwhile, other parts of the region are struggling to beat the pandemic.
Peru is the second worst affected country in Latin America, with more than 250,000 cases and more than 8,000 COVID-related deaths. Despite a continuing rise in cases, the government has brought forward the planned reopening of shopping centers and hairdressers in most of the country. Chile is the latest country to surpass the number of cases in Italy, an early hotspot of the pandemic. The death toll nearly doubled over the weekend after the government changed the way it tallies the figures to include probable fatalities from COVID-19. Chile currently has 242,355 cases with 4,479 deaths. Over in Mexico, fewer cases have been recorded than both Peru and Chile, but its death toll is much higher, with more than 21,000 fatalities. Just under half of all Mexican states, including Mexico City, are still in the red zone, under the highest alert, with bars and cinemas closed and sporting events cancelled. Mexico has recorded 180,545 infections. In Europe, citizens of Spain are overjoyed as the country reopened its borders for the first time since the lockdown implemented in March. Spain has also lifted its state of emergency, allowing people across the country to finally be reunited. The country's total cases sit at 246,272, with 28,323 deaths. In Asia, South Korean health officials believe that the country is experiencing a second wave of the coronavirus infections. Officials said that in the past 24 hours, 17 new cases have been recorded, stemming from different clusters in large warehouses and offices. South Korea has recorded 280 deaths, with just over 12,000 cases in the region.
Wear a mask on your face, not your chin, as it has no value under your chin. As we begin, you can find the latest guide on the NCDC website on keeping safe, as the centre continues to work closely with states, training health workers to manage COVID-19 patients to recovery. There's also the latest national strategy to scale up testing and other public health advisory. The World Health Organization's website has live updates as well. You can find the latest from them on the new threat, and that's the lack of solidarity and leadership, saying that is the biggest threat, and not coronavirus. It has more guidance for strategic action tailored to the local context. Our website, channelstv.com, has more updates. All you need to do is log on, channelstv.com. You can find the latest on the pandemic in Nigeria and across the world, plus other stories. That's the COVID-19 update. Thank you for watching. I'm Millicent Walker.